Did you know that 1 in 3 adults don't get enough sleep? Or that snoring could be a sign of something more serious than just noisy breathing? If you've ever woken up exhausted, suffered from morning headaches, or been nudged in the ribs for snoring, this might be something you need to hear. Your airway is a flexible passage. There are no bones holding it open. Instead, muscles keep it clear so that air can pass through freely. Think of it like a straw. When it's wide, you can drink easily, but if it's flimsy or bent, well, that's when problems start. As we age, gain weight, or deal with allergies, asthma, or even menopause, those muscles weaken. When the body fully relaxes at night, the airway can shrink, making breathing harder. Studies show that even a 10% weight gain can increase the risk of sleep apnea by 6-fold. We often joke about snoring, but here's the reality. It happens when the airway narrows and tissues in the throat vibrate. The sound isn't just annoying, it's your body telling you something is wrong. Snoring can reach volumes up to 90 decibels, as loud as a jackhammer. Snoring might seem harmless, but it can be a warning sign for something more serious. When the airway is partially blocked, we hear snoring, but when it fully collapses, airflow stops completely. This is called obstructive sleep apnea, OSA. When this happens, the brain panics, waking the body just enough to take a breath. This cycle can repeat dozens or even hundreds of times a night without you even realizing it. Severe sleep apnea can shorten your lifespan by up to 12 years if left untreated. Here's an intriguing connection. Teeth grinding, or bruxism, during sleep isn't just about dental health. It can be a sign of sleep apnea. Studies have found that up to half of individuals with obstructive sleep apnea also grind their teeth at night. This grinding may be the body's subconscious attempt to reopen a collapsed airway during sleep. So if you're waking up with jaw pain or worn down teeth, it might be more than just a dental issue. It could be your body's way of signaling a breathing problem during sleep. Do you suffer from any of these symptoms? Snoring, morning headaches, worn down teeth from grinding, feeling tired even after 8 hours of sleep, insomnia, fibromyalgia like aches? If any of these sound familiar, your airway might be struggling. And here's something important. Snoring and sleep apnea often have the same treatment. Many people think the only solution for sleep apnea is a CPAP machine, but here's another option: oral appliance therapy. Research shows that up to 80% of patients with mild to moderate sleep apnea find relief with an oral appliance without needing CPAP. An oral appliance, also called a mandibular advancement device, works by gently positioning your jaw forward, keeping your airway open all night long. It's comfortable, compact, and unlike CPAP, doesn't require a mask, hoses, or electricity. Did you know that some of the world's best athletes use airway-focused treatments to improve their performance? One of them is Shaquille O'Neal, one of the most dominant NBA players in history. Shaq underwent a sleep study at Harvard, discovered he stopped breathing 72 times an hour, and began treatment for his sleep apnea. He's since become an advocate for sleep health, using his platform to raise awareness and encourage others to take sleep apnea seriously. Studies show that even mild untreated sleep apnea can reduce reaction times by 20%, the difference between catching a game-winning pass or missing it completely. Breathing well at night doesn't just help you sleep, it affects energy, focus, heart health, and even athletic performance. Snoring isn't just a joke, it's a sign. And sleep apnea isn't just about feeling tired. It can affect your heart, brain, and overall health. But the good news, you have options. Remember, sleep apnea happens without you even knowing it. So if you've been told you snore, wake up tired, or you grind your teeth at night, don't ignore it. A simple conversation today could change the way you sleep and the way you live. As we've journeyed through the interconnected aspects of oral health, from achieving a beautiful smile with cosmetic dentistry and Invisalign to maintaining healthy gums and ensuring restful sleep by addressing sleep apnea, we see a common thread: the importance of a holistic approach to well-being. Each element supports the other, creating a foundation for a healthier, more vibrant life. Investing in your oral health is not just about aesthetics, it's about enhancing your overall quality of life. Remember, a confident smile, healthy gums, and restful sleep are all within your reach. Take the first step today toward a brighter, healthier future.